So good morning. Today we're getting together early in the morning after a few days because I had gone to my Mumbai clinic. So today we get together to discuss a common misconception, a common myth that PRP is a replacement for hair transplant. Many times patients come to me and ask me, Doctor, do you think I will benefit by PRP rather than go in for a hair transplant? So in some people's minds, there is no clarity about what is the right treatment for hair transplant because when they walk into the clinic, they are not well researched. They are ready to believe whatever the doctor is going to tell them. Most patients who have hair loss have an emotional problem with the hair loss, poor self-esteem, and several other issues, and they are a gullible lot. And this is the time when they should be explained all the options that are available to them and not take advantage of their gullibility and illiteracy as far as hair loss and hair loss treatment is concerned. So coming to the topic, in the realm of hair restoration, a prevalent misconception persists, as we have discussed, that PRP or platelet-rich plasma can effectively address even large grades of baldness. Grades of baldness like Norwood grade 6. And this misunderstanding, this myth, often leads patients to question whether PRP or hair transplantation is the optimal solution for their condition. And to dilate on this further, it is imperative to go into the scientific underpinnings and the clinical efficacies of either of these two treatments, that is PRP and hair transplant. So for patients who are not yet aware of what hair transplant actually entails, just going through in summary, a hair transplant is a surgical procedure which is designed to address your hair loss by moving grafts from the donor area to the recipient area, your bald area. People who are thinning or who are bald. And this technique of hair transplant is primarily, in a majority of cases, used to treat androgenic alopecia, that is male pattern baldness. But it can also be utilized for other patterns of hair loss like traction alopecia, for facial restoration, for scar repair, correction of past procedures, and several other things which are not in the ambit of this talk. We are dealing only with PRP versus hair transplant. So as people join in, you can ask questions, yes, as long as they are relevant to the talk, and also I will answer them after the talk is over individually. So primarily there are two techniques in hair transplant. One is FUE, which is prevalent in majority of cases. Almost like 99% of the cases done today are done by FUE procedure. So this technique of FUE involves use of motorized punches or manual punches, which harvest the grafts from the back of the head and the sides, and also from the body areas, chest, beard, and move them to the front. There is no difference in the plantation treatment of the bald area in either the techniques FUE or FUT. They are basically only harvesting techniques. Rest, everything remains the same. So the technique of FUE involves the extraction of individual follicles, as I said, directly from the donor area using a specialized punch. And these follicles are then implanted into the balding area. FUE by its very nature is considered as less invasive because there is no cut involved, there's no stitches. So definitely it is less invasive and the downtime is lesser. And patient acceptance is much more. And FUE has contributed to the widespread popularity of hair transplant, which FUT could not manage, because FUE is minimally invasive and it goes down well with patients who are seeking a cosmetic procedure and they don't want to go under a knife. FUE basically does not leave a linear scar which can be more noticeable. Not that FUT scars are always noticeable. FUT scars can be brilliant when done properly in expert hands. So this is a preferred method of hair transplantation today. As far as FUT is concerned, it is called a strip method, in which a strip of skin is harvested, cut out, an elliptical strip, and separated into grafts by slivering and cutting the grafts individually under the microscope. And the remaining area, which remains, the raw area, is stitched in 2 layers using either trichophytic closure or non-trichophytic closure. So these are the differences between the 2 techniques. Can FUT be done by an FUE surgeon? We'll deal with those questions later. Please hold on to your questions. So hair transplantation is typically performed under local anesthesia, and it is not done as an inpatient treatment, outpatient patient basis. Patient comes in the morning and walks away in the afternoon and the evening, depending upon how long the procedure was. The duration of the procedure depends on the number of grafts being transplanted. Post-operative recovery involves minimal discomfort, with most patients experiencing just mild heaviness, redness, swelling, sometimes a little swelling over the eyes, and then crusting happens in the planted area. The donor area starts to look normal after 1 week when the remaining hair grows out, whereas the recipient area is noticeable for 2 weeks till the crusts come off. And the full results after hair transplant take about 6 to 9 months after the procedure. Hair transplants are a permanent solution to your hair loss, provided you take permanent hair and you do it in the right indication. Don't do it in say, diffuse pattern alopecia, diffuse unpatterned alopecia, then it's a failure. The basis of hair transplant is that the grafts taken from the safe zone, the permanent zone of the back of the head and the sides, are genetically resistant to balding, and this is the basis of hair transplant. Sometimes patients ask, what is the guarantee of that my hair are thinning here? If I plant new hair, they will also not thin out. Well, this is the answer, that these are genetically programmed to survive for a long period of time. Permanency, whether they are permanent, is questionable. Everything in this body is impermanent. It is only that these hair will last for a long, long time, 30 years, 40 years. But to say that they are permanent, I would not like to put a bet on that. However, the success of procedure depends on various factors, including the extent of hair loss, the quality and the density of the donor hair, and the surgeon's expertise. A good qualified FUT surgeon should do FUT, not that the FUE surgeon is doing FUT, because they're all specialized procedures. You have to be either, in today's times, specialized in FUT or FUE. If you're mixing, the team gets confused, and it's not a good thing to mix procedures. It's important to note that while transplanted hair is permanent, patients may continue to experience hair loss in other areas as the baldness progresses, because hair transplant is not a definitive treatment for androgenic alopecia. It's a genetic problem. We are just covering the bald spots as they appear. If more appear, you will need more hair transplant or medical treatment. But hair transplant is a viable and effective solution, an option for individuals who want to restore the hair in the balding areas, hair which will last for a long time, perhaps even a lifetime. And then we come on to PRP. What is PRP? Basic definition of PRP is platelet-rich plasma, which is platelets taken from your blood, draw from the arm, the blood is drawn out, and this is separated into its components, that is platelet-rich plasma. And this platelet-rich plasma, when injected, activates the follicles and causes betterment of the hair, which are thinning, and increases the hair shaft diameter. But it is a treatment which is repetitive in nature. It's not that you get a PRP done now and you're all set to go, like in a hair transplant. It is surely not. So it utilizes your own blood components to stimulate tissue repair and regeneration. In the context of hair transplant, PRP has garnered attention for its potential to promote hair growth in individuals experiencing androgenic alopecia and also other forms of hair thinning. So how it acts? PRP is derived by centrifuging a patient's sample of blood, say about 100 ml, and platelets are concentrated from the plasma, and these platelets are rich in growth factors such as platelet-derived growth factor, PDGF, and TGF-beta, that is transforming growth factor. and other vascular endothelial growth factors, which play pivotal roles in cell proliferation, that is cell growth, spread, angiogenesis, that is development of new blood vessels, and tissue regeneration, tissue which are dying out or tissue which need repair are regenerated. So when we inject it into the scalp, these growth factors stimulate dormant follicles. They prolong the anagen phase of the hair cycle and enhance vascularization around the follicles. And this thereby is said to potentially promote hair growth. PRP involves several steps. One is blood collection, as we said. Blood is drawn from the arm. It is centrifuged in a specialized centrifuge machine so that the platelet-rich plasma is isolated. And then, optionally, it can be activated by means of calcium chloride or thrombin to activate the platelets before injecting them. But it is rarely needed because the very flow of the PRP through the small, minute syringe needle is enough to activate it. This entire procedure is minimally invasive and typically completed in half an hour to 1 hour. So clinical studies have indicated that PRP therapy may lead to improvements in hair density, thickness, and overall scalp coverage in patients with early to moderate androgenic alopecia. However, its efficacy in advanced stages of hair loss like grade 5, grade 6, grade 7, when it's completely slick bald, where the follicle units have gone away, they have miniaturized to such an extent that they are not retrievable. This use in this circumstance remains limited. In such cases, PRP may serve as an adjunct to other treatments, such as hair transplant, to treat the transplanted hair, to enhance graft survival and post-operative healing, but this is questionable. PRP therapy is generally considered safe because it's your own blood, it's autologous blood, and it minimizes the risk of allergic reactions or disease transmission. But some minor potential side effects are typically mild and may range from, say, pain at the injection site for some time, scalp tenderness, and a little minor swelling. It is important to note that PRP is not a one-time treatment. Multiple sessions are required to achieve and maintain a desired result. The optimal number and frequency of treatments usually is every 3 weeks for 3 months, and then every 3 months for a year, and then maintenance basis as and when required. But this optimal number and frequency varies from person to person. It is individualized and depends upon the severity of your hair loss. So PRP therapy represents a promising, minimally invasive option for individuals seeking to address hair thinning. In androgenic alopecia, if it is not too severe, early stage of hair loss. It is never a standalone treatment for advanced baldness. Its role as part of a comprehensive hair restoration strategy continues to be explored and refined within the field of aesthetic medicine. So clinical studies have demonstrated that PRP therapy can enhance hair density and thickness in individuals with early stage androgenic alopecia. However, its impact on advanced baldness, as I've reiterated time and again, is limited. Hair transplant is the only viable solution for slick baldness, grade 5, grade 6 baldness, grade 3, even when there's slick baldness, there's not only thinning. So it is crucial for medical professionals to provide patients with accurate information regarding these two procedures, hair transplant vis-a-vis PRP, make them understand the limitations and potentials of each treatment modality, recommend PRP therapy for individuals with minor grades of baldness, early thinning, where they might produce a salubrious effect. Otherwise, it is going to basically lead to patient dissatisfaction and ethical concerns, patients' loss of trust in the hair loss industry, which as it is quite humongous. So a thorough assessment of the patient's condition and candid discussions about realistic outcomes are essential to uphold our integrity as doctors, to fortify patient trust in us. So that was the day. That was the talk for the day. If you have any questions about PRP, about hair transplant and PRP, or any other question about hair loss treatment, which you want to be addressed in this session or in the next one to follow, please let me know. Just send a comment in the comment section below. And for all the questions that have come, I will take my time after I do my case today, and I'll get back to you with the questions, with the answers to your questions. Have a nice day and God bless you.